Good morning, good afternoon, good evening mga kababayan. Magandang umaga, magandang tanghali, magandang hapon, magandang gabi sa inyong lahat ng taga-subaybay, lahat na nagsusuporta ng aming channel, King and Bella Vlog, lahat ng nagsusuporta, lahat po ng mga pbteam, nangungunahan ni Sir Paul, sina Khopars Vlog, Madam Yula, Mang Juanshow, Mang Eli, pbteam Nonoy, lahat po ng pbteam. Salamat sa inyong lahat. Again, I would like to express my gratitude to all of you. It's Saturday morning. I'm getting ready to go to work kasi open po kami ngayon. Magdadala po ako ng pizza for their lunch. Marami sila, 10 ata ngayon sila, Saturday. So I'm just gonna bring at least 4 boxes of pizza. Tingnan ko lang po kung ano. Malamig po ngayon dito sa amin and California have a storm, kaya umuulan po, napakalakas po ang ulan, kaya lang hindi mapigilan lahat ng mga, alam nyo na, mga pasyente na pumupunta pa rin kasi may sakit sila. Anyway, I'm trying to get my husband to answer a few questions and then I could leave from here. Meron po akong sasabihin sa inyo, yung ating vlog, King and Bella, meron ng pera po. So, as I told you, all the proceeds will go back to our kababayan or people that in need of our help. Lalo siyempre, imamanage po ng pbteam yan, ibibigay natin kay Sir Paul. But, the good news is, lahat po ng proceeds ng pbteam every month, my husband and I will match. Kung kunwari is 1,000 and then me and my husband will match that money. Okay, tapos papadala po namin kay Sir Paul o kaya kay Khopars Vlog para sa ganun, imamanage po nila. Tingnan nila kung sinong may kailangan sa mga pbteam. And that way, it will spread. Hindi lang po sa isang lugar mapupunta. But then, kung may pabahayan tayo, as I said, lahat ng proceeds, it depends kung anong gagawin po ni Sir Paul, kung anong ikagaganda ng proyekto nila. Okay, so that way, we will use all that. So at the end of the month, we will announce po kung magkano ng pera, and then, from Dr. Smith and I, we will match that amount. As I said kanina, pag 1,000, kami rin po magbibigay ng 1,000. Okay, kaya please help us. Keep watching our vlog. Alam niyo naman po ako, kahit hindi naman ako marunong mag-vlog, kaya tinutulungan nila ako sa Pilipinas. You know, khopars, RJ is helping me, so as Mang Juanshow. Kasi Sir Paul is very busy. At tapos po, another announcement is every single month, we go live with khopars, with RJ. Mang Juanshow and khopars. Pag available si Sir Paul, that will be great. But if not, kami ni khopars. And every single month po, we will give away 10,000 pesos. I-divide namin po ang gagawin po namin is 2,000, 3,000, and then 5,000. Yun po ang gagawin yun lang naisip ko. Para sa ganun, we will ask questions kung sino po makakasagot nun, and then we will Gcash daw nila yung pera, sabi ni Khopars, okay? So, abangan po, mag-question po kami tungkol sa vlog ng King and Bella. So, abangan po nyo, we're planning to do it Sunday, which is Monday, I believe, in the Philippines, Sunday here in California. Again, salamat sa inyong lahat. Keep watching us. Keep watching King and Bella. Keep supporting pbteam. And then, the money will go back to our kababayan who are in need of our help. Okay, sandali po, titingnan natin kung si Dr. Smith is available. I have a couple of questions, okay? Sandali. Welcome, Dr. Smith. Good morning to you. How are you doing?
Good morning. It's a stormy day, but I'm feeling fine, thank you.
Okay, good. Dr. Smith, I know you're very busy. Dr. Smith is working, actually, some reports in his computer, so I asked him if he could stop for at least 2 minutes, 3 minutes, so that's all it takes, Dr. Smith. Anyway, he's in our room, working. Dr. Smith, say hi to our viewers, our subscribers, and everybody that's watching, and everyone that's been following us. So will you please say hi? And
Good morning, everybody. It's so nice that you could tune in today. I am very happy to share medical knowledge with everyone, with the understanding that this is, of course, as specific as we can be without personally examining a patient and having that personal interaction.
anyway, Dr. Smith, one of the viewers is asking, from where are you? Where were you born?
I was born in the state of New York in the United States, in a cold farming area near the Great Lakes. And I lived in Buffalo, which is a very cold, snowy area, while I was in college and medical school, graduating from the University of New York. And then I moved to California in 1979, and now I reside and love the Sacramento area.
Why did you come to California?
For the sunshine.
Oh, you didn't go to UC Davis?
I finished my training at UC Davis and did work for UC Davis.
That's University of Davis po here in Sacramento, California. Anyway, Dr. Smith, one of our viewers from Eva, I think is her first name. I cannot pronounce the last name. Let me ask you a question. Just one question today. We'll do it one at a time because there's so many questions and I know you're very busy.
Okay.
Her daughter, I believe, is 17 years old. She's a senior. She was diagnosed to have a hyperthyroidism. And they already exhausted second opinion from the doctor. They go to the hospital. They already spend so much money. And again, as I said, she's a senior. From hyperthyroidism, it went to hypothyroidism. And now, again, it went back to hyperthyroidism. What can they do? Or at least an opinion from you.
Treatment of hyperthyroidism varies with age and the actual cause of hyperthyroidism. The most common cause is called toxic goiter or Graves' disease. In a young patient, such as a high school student or someone under the age of 40, the classic treatment would be medication to reduce or suppress the function of the overactive gland.
So what kind of medication is that? What can you recommend?
There are several kinds. Methizamol is typically used.
Methizamol. How do you spell that?
METH.
METHEX. IM.
AZOLE.
AZOLE.
Methizamol.
Okay.
It may have a different name in various parts of the world. It comes in several dose ranges and can be a little difficult to manage because of the nature of Graves' disease, which varies. It can be affected by nutrition. A patient with a large goiter who eats a high iodine food, such as some seafood products, may suffer an increase in the overactivity, which could precipitate a life-threatening condition called thyroid storm.
Okay.
Many times that is what brings the diagnosis to light and allows the doctor to begin treatment. During episodes of overactivity, common symptoms include unexplained weight loss, difficulty sleeping, tremor, which is a shakiness, which is not appropriate, such as a 17-year-old lady should never have tremors, rapid heartbeat, sometimes even difficulty breathing, or cardiac arrhythmia. the most common additional treatment just for symptoms would be a beta blocker, such as propranolol or metoprolol,
So,
to help control symptoms.
so beta blocker po, i-google nyo na lang po kung anong meaning yun, ha? Kasi he's talking about propranolol and atenolol.
Well, there are many different ones, atenolol, metoprolol, but beta blockers are a great adjunctive therapy to a drug like methisimol to control the symptoms, and it does help with almost all of the symptoms. Sleep aid may be necessary, or even something to calm the nerves, as anxiety is often present. Even psychotic type reactions can occur but are much less frequent and hopefully do not require medical intervention. The goiter itself can be symptomatic, and if large enough can cause difficulty swallowing or even respiratory conditions, and should be looked at by a surgeon if these symptoms do occur. The goiter will sometimes reduce with therapy but will not go completely away. The preferred treatment for younger patients who fail to achieve control after 1 year of therapy with medication, and especially if they have a second year of medication with failure, would actually be surgery to remove all or most of the gland.
Ayun po ang sinasabi niya po, kung malaki na yung goiter nyo dito sa leeg, so it may require for you to go to see a surgeon. Yung surgery po kung malaki na daw at nahihirapan kayong mag-swallow. Yung swallow, I don't know the Tagalog term. But anyway, and he's recommending po yung levothyroxine once a day.
For hypothyroidism.
For hypothyroidism. Yung hypo, di ba? Nag-hyperthyroidism and then nagiging hypothyroidism.
If the overactivity cannot be controlled, it is better to convert it to hypothyroidism, either through surgery or administration of radioactive iodine, which has the same effect in causing the thyroid to have reduced function. And typically, patients will require lifetime treatment with levothyroxine once daily in a range somewhere between 75 micrograms and 250 micrograms per day. It is variable and would best be managed by an endocrinologist or a gland specialist.
Okay po, sana naintindihan niyo po, ito daw is a lifetime na kukunin ang levothyroxine, which is from 75 microgram to 250 microgram. And then they said, iodine, what is that iodine?
You need to limit iodine intake if you have an overactive gland.
Can you
Many
give us
patients
an
with goiter.
example of an iodine?
Well, iodine actually is added to salt in many countries. So be careful that if you are adding salt to your food, that is plain sodium chloride and not an iodinated form, which is extremely common here in the United States. Seafood is typically high in iodine because the water in the ocean contains a significant amount of iodine. So limiting seafood may also be necessary until treatment has occurred. If treatment has occurred and the Graves' disease is now eliminated, then normal amounts of iodine are again safe.
So po, sabi niya, limit your intake. Kukunti lang po yung mga seafood because seafood has a lot of iodine kasi galing, yung seafood galing sa ocean. Maalat yun. Okay? Hanggang hindi po kayo gagaling. Okay? So, well, Dr. Smith, Is there anything else, or?
Yes, Graves' disease, the typical cause of toxic goiter, is an autoimmune disorder and does run in families. There has been investigation into immune therapies, which may soon be available, if not already, in experimental phase, which will give us an additional modality of therapies, especially for younger patients. I might mention, although our patient is 17 years old, in older patients we typically prefer radioactive iodine if they're unable or it might be unsafe for them to undergo surgery. But younger patients are best treated with surgery.
Well, thank you, Dr. Smith, for that advice, for the knowledge and education about hyperthyroidism versus and hypothyroidism. We're happy that you answered that question. I know you're very busy. Hope you could do it again sometime this week.
My pleasure, anytime.
So thank you again. One question po, just let us know, okay? Salamat sa inyong lahat. Salamat sa inyong pagtatangkilik. Have a wonderful day. Please, King and Bella Vlog. We love you all.